March is observed as Cerebral Palsy Awareness Month, set aside to raise awareness as well as advocacy for children and caregivers living with the condition. Today on the program, we'll take a look at how to increase the welfare of about 17 million people living with cerebral palsy. Good evening. I am Olasumbo Modupe, and the program you're watching is Sound Health on Lagos Television. The conversation begins after COVID-19 updates. Please stay tuned.
There is continuous global increase in COVID-19 cases driven by large outbreaks in Asia and a fresh wave in Europe. The World Health Organization says several countries are now seeing their highest death rates since the beginning of the pandemic. Director General of the agency, Dr. Tedros Ghebreyesus, explained that this reflects the speed with which Omicron spreads and the heightened risk of death for those who are not vaccinated, especially older people. He added that until there is high vaccination coverage in all countries, people will continue to face the risk of infections surging and new variants emerging that evade vaccines. Even as some high-income countries propose a second booster dose, 1/3 of the world's population remains unvaccinated, but there are some promising signs of progress. Citing Nigeria as an example, where vaccine uptake was dramatically increased when supply stabilized and planning was done on how to effectively distribute vaccines. Dr. Ghebreyesus says the agency's target remains to vaccinate 70% of the population of every country by the middle of this year, with priority given to health workers, older people, and other at-risk groups. Achieving that target is essential to save lives, prevent the risk of long COVID, protect health systems, and increase population immunity. Other tools, including testing, sequencing, and contact tracing, also remain essential, and it's vital that countries don't abandon the capacities they have built over the past 2 years. The Africa Centers for Disease Control and Prevention says over 250,000 people have died from COVID-19 in the African continent since the outbreak of the viral infection. The Africa CDC, in its latest update, disclosed that over 11 million cases have been recorded on the continent so far, with over 10 million recoveries. The agency stated that the continent has now recorded 11,322,887 cases and 250,942 fatalities.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is retired Air Vice Marshal Femi Gbadebo, founder Benola Cerebral Palsy Initiative. Good evening, and thanks for joining us this evening.
Good evening, Lord. Thank you for having me.
All right, let's start the conversation. For the benefits of viewers, what makes cerebral palsy different from other conditions?
Well, it is in the same group as what you call neurodevelopmental disabilities, where you have autism, Down syndrome, and a lot of other learning disabilities. But cerebral palsy is unique in the sense that it affects the motor part of the brain. And so one's ability to move some parts of the body or major parts of the body is affected, particularly the tongue, which we use to swallow. And so a person with cerebral palsy will triple. That means they will drop speech. And then you'll find that many of them have issues with controlling the movement of their hands, their fingers, their feet. And as they grow beyond the age of 5 years, we begin to see physical distortions in their bodies. the sense that arms, the legs get twisted, and stiffness comes in. There's incontinence in the sense that a lot of them cannot speak well or cannot even speak at all. And then because the stomach muscle is affected, their ability to control their bowel movement, urine and stool, is also affected. So if we don't have parents who are well trained in how to manage these children, not only will they not look appealing to members of the public, there will be a lot of foul odor either around the child and even in the home where such a child has been kept.
According to the World Health Organization, self-denial and late presentation are one of the major challenges reducing increased awareness about this condition. How do we change the narrative?
Well, they say knowledge is power, and lack of knowledge creates its own limitations. And the major limitations with what we do not understand, especially when it's physical, in a society like ours where there's a lot of belief in the supernatural, is to begin to think that children like this are possessed by evil spirits, and that the condition they're going through, for every child that drops saliva continuously, may think that saliva touching you could be contagious. So people are afraid of infection, they're afraid of being contaminated, and so on. And that creates a major problem in raising awareness and even coming close to children like this. Now, this kind of negative attitude is transferred to the mother, or which of the parents decides to take this child either to the hospital or out of the home. And you'll find that in public transport, people will say, hey, I don't want this child near me, and so on and so forth. And this kind of negative talk really affects the mother of the child. And at the end of the day, most of them are forced to stay indoors, away from society. And we have found so many of them, even with children as old as 17, who think they're the only ones who have a child like this. And so one of the things we're trying to do, especially with this Cerebral Palsy Awareness Month and the day on the 25th of March, is to continue to advocate, to tell people the realities of cerebral palsy, and to let people know that this condition is not infectious, it's not contagious, and in fact, when properly managed, a lot of the children, even those of them who are non-verbal, meaning they cannot speak, are able to do very well for themselves in society, because through the use of body language, sign language, and so on, and exposure to early education, many of them have grown to prove that they have very interesting capabilities that even surmount that of our so-called normal children.
I want you to share from your experience over the years. Do you think cerebral palsy is treatable rather than just being managed?
Well, the truth is that cerebral palsy, as of today, has no cure. It was identified over 80 years ago. And there was a lot of excitement. You see, when there are problems, scientists and medical researchers start working, and there's grants, funds for them to continue to do their work, investigation, see so many children, and so on. And as long as there is the potential for a cure, the grants keep coming. But within 25 years, which is over 50 years ago, it was established that once you have cerebral palsy, you have cerebral palsy. It has no cure. The condition cannot be reversed. However, management options exist, and when these children are managed properly, like I said, they grow up to be adults who can contribute tremendously to the society in which they live. Unfortunately, when you are in a society where the belief is that, oh, it has no cure, then a child of 2-3 years old is left to his or her own devices, not exposed to the right kind of therapies, not exposed to education, and by the time they're 15, 20 years old, they're not really able to do much for themselves. So that's why for a long time now, the emphasis has been on early intervention. First of all, getting the parents to understand the condition of the child, getting to know the potentials of that child, and getting to know why we must begin to find ways to actively engage the child educationally and otherwise to make sure that they live a much better life.
Okay, thanks for that clarification, because we've had some parents say with stem cell therapy, there could be a lease of hope or life for persons living with cerebral palsy. So in that case, how do we manage the condition? How do we manage the condition? How do we manage persons living with the condition now?
Okay, like I said, there are very numerous management options. From when the child is very small, there are therapies that can help to manage the stiffness and seizures. I mean, okay, they also have seizures because of short circuits in the brain. And when there are seizures, it's further the child's condition probably further deteriorates. And so there's medication that can also help with stiffness, and medication that can help with seizure control, help with maybe one or two other things the child is going through. And then you have therapy. Physiotherapy is very important. Occupational therapy, which is where you bring in for a small child play as a form of therapy. You know, when they lie down on a mat and you put down the colored balls and so many other things, and the parent calls them and so on, they have to be done on a regular basis. Now, because the child has cerebral palsy, the chances are that they will have what we call comorbidities. That means if the child cannot move their hands, of course, what will happen is that when mosquitoes come, it's not able to swat the mosquitoes away. So mosquitoes will have a field day. A child like that will continue to have numerous bouts of malaria. If the child is drooling and lying maybe on a towel, and there's a fan on an air conditioner, and somebody is not attentive to change this towel regularly, then the child will be lying on a wet towel, and then you'll find numerous cases of pneumonia and so many other situations like that. So you'll find that children with CP, particularly when they're small, constantly going in and out of hospital. But it's not because they have CP. It is because of what I call these comorbidities, attendant medical conditions that they are unable to manage or cope with because of the peculiar situations in which they find themselves. So apart from managing the children, managing the parents, educating them on what they need to watch out for, things they need to do, and so on, is important. Even when it comes to feeding, you see, when this child has a problem with stomach muscle control, and you believe that, okay, they can eat normal stuff that the adults are eating in the house, the chances are that they'll get constipated. And as they get constipated, then more complications come up. In where sometimes you have to take them to the hospital for total evacuation of their bowels. But you see, as parents get more comfortable, even with some of the therapies which cost money, you begin to see that the parents can do some of the things at home themselves. They can reduce their hospital visits because now, this happens. Instead of panicking, they already know that this is why it's happening. And so at the end of the day, it is in the best interest of the parent to get as much knowledge as they can about this condition and to understand that it's a long journey. And there are many options like Benola out there now that are giving the right information. And there are other parents too who are beginning to come out willingly and help in sharing their experiences. And you see, if somebody has a child that's 10 years old and your child is 5, 6 years old, they've been through that journey. And so they're in a position to share their experience with you and encourage you as to the fact that, look, things are not going to be this bad all the time, and there's going to be more. possible positive activities down the line.
Okay, retired Air Vice Marshal Badibo, you've said so much about managing the condition on the part of parents or caregivers. Now, what about policies? Are there policies on the part of government to ease the impact, social impact, as well as welfare of persons in this category?
Well, I'll tell you, that's where we have a major problem. Like I said, in the US and the developed countries, once they realize that cerebral palsy has no cure, and of course it's not contagious or infectious like polio, things like Ebola and COVID that we have now, that they're throwing a lot of money out. Funding for research into cerebral palsy stopped. The developed countries came up with policies where medication, therapy, even financial assistance is given to the parents of the child to help manage the child through the process of life. But here in Nigeria and most African or third world countries, those conditions do not exist. It's like you have a child with cerebral palsy and you are on your own. Nobody, not your local government, not your state government, not the federal government, comes to your assistance in any way. Of course, there is a policy under the federal health policy that says that children under age 5 are entitled to free medication. But unfortunately, this policy is not well articulated and it is not funded. So you go to any health center or any medical center, like the general hospital, and everybody just looks at you and said, okay, so there's a policy, but who's going to pay? Okay, so you find that all the cost of therapy, medication, and even all little things like respite for the parents, because you see, caring for such a child 24/7 can drive somebody crazy. So there are a lot of parents, mothers in particular, who are stressed. My phone, my WhatsApp line is constantly being bombarded by women who have one simple message: I'm tired. I want to kill my child. In fact, yesterday I just got another woman who said, my relations are not interested in helping. And I just think maybe if I kill myself, maybe then they'll have to come to the help of these children. That's how desperate mothers are, and in some cases, some fathers. And society really needs to wake up and begin to figure out how do we come out and help these children.
Okay, as we wrap up now, your call to action to every key players, to every stakeholders in this regard. How do we move from this point to changing the narrative?
Changing the narrative requires more education and also awareness. We have a very sad situation in Nigeria that is not just about cerebral palsy, it's about every disability, including even abandoned children and old people who homes that take care of old people. The general mindset in Nigeria is that you buy some foodstuff and you go there and with some friends and you take some photo of which you put on social media. Okay, me too, I'm doing something for the less privileged in our society. And even some people are using that as a way of asking for financial support. At the end of the day, it's not really about what these homes, centers, or even families need. In fact, it's only for homes and centers. There's no real effort to reach out to the families. And there are lots of parents, particularly mothers, who just cannot go and throw their children at home. They can't abandon that child. So they're living in their own squalor. They're going through their depression alone and so on. So that's where education and a need for a change in mindset needs to come in. Because it is only when we get our mindsets changed about managing disability. I mean, I don't want to mention anybody, but you know what I'm saying, that there are some organizations, all they want to do is come and paint your home with their own colors. They may give some money or something, but at the end of the day, they're just using that home to brand themselves, to sell themselves. Okay, the same thing with, like I said, the foodstuff. If you bring, let's say, yams and rice to a home, what about the condiments? What about the oil? What about the water that the children are going to drink? So I think we need to begin to engage these homes and places more in terms of exactly how can we help you. And when you have organizations like Benola that are working on advocacy, then it's about money to do the work we're doing in the media and on social media and the brainstorming sessions and workshops and conferences, and even counseling that we're doing for parents directly. Some are online and some are one-on-one. These things take time, they take data, they take a lot of stuff. And to be honest with you, even those who are in the NGO business, there's fatigue. People talk about donor fatigue, but there's also fatigue. By the time you get 10 of these kind of messages of a mother trying ready to kill herself or kill her children or whatever, you don't sleep well. And even if you dip your hand in your pocket, how much help are you going to render? And so on. So, but we have found that by encouraging these parents to come out and tell their story, to share it in public, to make it available for other well-minded Nigerians to begin to help to source for assistance. A lot of things are happening. A lot of people are getting help. And we pray that going forward that there'll be a lot more to do.
Retired Air Vice Marshal Femi Gbadebo, founder Benola's Cerebral Palsy initiative on how to manage cerebral palsy. Thank you so much for your time and expertise on the show.
Hey, thank you so much for having me, and you have a very lovely night.
All right, it is still Sound Health on Lagos Television. Up next is Trending Health Report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Whatever you do, ensure you show love and respect to persons living with any physical challenge. They are also special. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.